Hi, Trina. Good morning. Yeah, so in terms of how the session goes, I hate doing presentations that just kind of drone information into you. So if you've got any questions as we go along, please do stop me, please do interact, please do ask questions. I'm happy to do that as we go along, okay? So we'll get started. Can everyone see my screen? Yeah?
Yes.
Perfect. Okay. Okay, so about us. So we're BMR Health and Wellbeing. And what we do, as Carl was just alluding to then, we look at workplace wellbeing, but we take the approach that we really need to be looking at doing workplace wellbeing in a very systematic and a very data-driven way, that's focused on identifying the root causes of workplace stressors. Okay, what I will say is that you'll have a recording as well, at the end of the session today. So what we're looking to do with businesses is to actually get workplace wellbeing taken away from being this kind of fluffy, yoga-driven, fruit bowl-driven kind of approach to really having a look at this a whole integrated approach. So some of the initiatives that are out there, absolutely fantastic and absolutely worthwhile, but they're single parts of a bigger puzzle. So what we're going to be doing today is we're just going to be looking at what your statutory legal requirements are for workplace mental health in the UK, because it does exist and it exists in law. And I'm just going to give you a couple of examples of case law around that and the consequences for businesses in the past who have failed to meet that statutory legal requirement, okay? We'll just have a look at some statistics in terms of the size of the problem and looking at this total integrated approach to workplace mental health. So if we're not just doing fruit bowls, yoga, EAP and MHFA, what else is it that we need to be doing as organisations and as employers? And then we'll touch on the new ISO standard that's coming out later this year, hopefully June, July, that should be released. And we'll actually look at what psychological hazards are, because the new ISO standard is all about risk management and mitigating psychological hazards in the workplace, and looking at ways that we can actually measure our return on investment, okay, when we're looking at our wellbeing management plans, okay? So let's move on to the legal framework. Sorry, I'm trying to do two screens here, which is always a bit of a black art with me. I'm just trying to get with the program with this. Yeah, so I'm not always brilliant at it. So who is familiar with the law around health and safety, and specifically psychological and psychiatric injury? Anybody? Just unmute yourselves rather than drop it in the chat.
I know that there's been some things that have shifted and changed. It's built into the health and safety policy that any stress effects that have been found to cause on an individual could be followed through in a tribunal now.
Yeah, no, the law is really clear. Health and Safety at Work Act, Section 2, you know, employer has a duty of care as far as is reasonably practicable, okay, to look after the health, safety and welfare of all employees. We do safety really, really well because we can see safety, we can see physical safety. So that's a given. We do that well, but because we can't see welfare, because we have this whole stigma around mental health and we always perceive it as being ill health, it doesn't get done in exactly the same way. So we've got the Health and Safety at Work Act, absolute law, you have a duty of care. Then the Management of Health and Safety at Work regulations says, and in the way that you execute that duty of care is to carry out risk assessments, provide competence information, resources and training, not just to one or two people and a mental health first aid here and there. The whole organisation needs to have some level of understanding around the psychological risks that exist in the workplace. So the law is clear. The Act is what you have to do. The regulations are how you should do it. And then what we've got underneath that are all the best practice guidance documents. So, you know, in this UK, we've always had the Health and Safety Executive Stress Management Standards in the UK, and that's great. And they identify 6 of the key psychosocial hazards in the workplace, which we'll come on to later. But then we've also got this new document that's coming out later this year, which is ISO45003. And I'm not sure how many of you, if you just kind of give me a hands up or whatever it is you do on Zoom, are familiar or have ISO standards in your workplace already. Trina, I know you guys have, don't you? In terms of the occupational health standard, yeah? Paul, you have that as well. Excellent. Hi, Cassie.
Hello.
Yeah, so we've got this ISO standard coming out this year, and this is actually going to be a real game changer, and I'll come on to that and to why that is as we move through the slides. Okay, so just sticking with the case law, I've given you the health and safety law there, but there's also other laws that cover mental health. It's covered in the Equality Act, and it's also covered in the Protection from Harassment Act. Okay, so if we look at some of the case law, we've got an example here of Walker v Northumberland County Council going way back to 1995. Okay, and this set the precedent around the employer's duty of care being extended to the risk of psychiatric illness. And what happened here was Mr. Walker was a social worker employed by Northumberland County Council, and he had a really heavy and demanding and emotional caseload, okay, as you can imagine with a social worker, and he suffered a mental breakdown. Okay, so on his return back to work, when he came back to work after he'd been off ill, he repeatedly requested help and assistance, right? But he received no additional support. So as a consequence, he suffered a second breakdown. Okay, now he was then dismissed due to ill health, so he brought an action against his employer for breaching their duty of care to take steps to ensure he had a manageable workload. So the first time they wouldn't have been held accountable. They weren't to know. The first time it wasn't reasonably foreseeable on the part of the employer. Okay, but the second time round it was. If somebody's been made ill by a set of conditions, you know, if somebody's finger gets chopped off because there's a machine guard missing off a machine, you wouldn't leave the guard off and expect it to not happen again, and that person just doesn't put the finger in the machine. We just wouldn't do it that way when we approach physical safety. So why do we expect that we've got a different duty of care when it comes to psychological safety? Okay, so that set the case law. Then with Barber and Somerset, that set further principles around law. But the point I'm trying to make is, and I don't want to go into the law too much, is that the law exists, the law is used, and I'm hearing a lot more on LinkedIn and through HR people that there are a lot more talks around stress tribunals and stress claims against employers, and they're not really sure how that's going to pan out throughout as a result of COVID. Okay, so I think as there's more profile raised around psychological health and safety and around the fact that the employers have this duty of care, the more potential there is for people to start to get an understanding of this and start to use that law. Okay, you know, and there are some heavy penalties. You know, these two case laws here, these were where an employer was held vicariously liable under the Protection from Harassment Act. So this was about bullying in the workplace. Okay, and in the case of Helen Green versus Deutsche Bank, she was awarded £800,000 under Protection from Harassment Act and a further £35,000 for psychiatric injury. So that was a massive award. Okay, so employers have a responsibility, employers have a duty of care. But just going back to the other side, you know, the employer must be in breach, the employee must be able to prove its psychiatric injury, and it must have been reasonably foreseeable. If you don't disclose to your employer, how can you expect them to know? How can they reasonably expect that to be an issue? Okay.
Sheila, does this apply for organisations of all sizes?
All organisations. It's complete. It's just complete law. Absolutely.
Okay, great.
Yeah.
Thanks.
Yeah, absolutely. Okay, so when we look at the size of the problem in the UK, it's huge. Okay, and all of these figures, and it's not just the UK, the size of the problem is huge globally. All of these figures that are here are pre-COVID. Okay, so if you look at the cost of mental health according to a Deloitte report last year, which is the updated version of the Farmer Stevenson report that was originally commissioned by Theresa May back in 2017, they estimate the cost of mental ill health in the UK is around 42 to 45 billion. And if you look at the diagram on the right there, that's made up of 6.8 billion in absence costs. So these are costs that we can actually touch, feel and measure. Same with turnover costs and exit costs out of the business, 8.6 billion. And then this figure in the middle, the presenteeism figure, you know, there are many experts out there that would say that that's a really conservative number. Yeah. And, you know, show of hands here, who has ever gone into work and just had a bad day or a couple of bad days or a bad week where you've just coasted? You've not done much. Yeah, we've all done it, haven't we? Yeah. And I'm not saying, you know, we'll eradicate presenteeism. It's always going to exist. We're human beings. We disconnect and we switch off sometimes. But, you know, if we can reduce that amount of presenteeism in the business, then we're doing well. But you can imagine, you know, I know if I'm honest, in the last year of my job, the last 18 months of my job, I was totally disconnected. Totally. I may as well have not been there for all the benefit they were getting out of me. But they were spending a lot of money, more than a workplace wellbeing program would have cost them, more than investing in their employees and making employees felt valued and appreciated would have cost them. And I know I wasn't the only person. So, you know, this presenteeism cost is really, really high. And if you look at how that translates when they're looking at average cost per employee, it's around about £1,700. And that is a slight variation on that. It's about £1,600 for public sector, £1,700 for private sector. And it actually doubles when you're looking at the financial sectors. So when you're looking at banking and insurance and some of the bigger financial sectors, that's estimated to be around £3,400 per employee, okay, per year. So it's high. The scarier number for me is last year's working days lost due to work-related stress, 17.9 million. That was up 5 million from the previous year. And that, again, pre-COVID, you know, what is that number going to be like next year? So these numbers are absolutely on the increase. But it's not all bad news, because if companies are investing well in wellbeing programs, you can see, and they do see, a return on investment. They're as low as 2 to 1. They're as high as 9 to 1. The average number is around 5 to 1. So we have to be investing in it. Organizations, it's like, you know, back in the 70s when we, you know, started to have safe working practices around actual safety, there was a reluctance to businesses to take it on, but eventually it becomes the norm. And that's what we'll see happening with psychological hazards. We've got a health and safety framework. We've got health and safety law. We've got quality management standards. All we're asking you to do is recognise the 8 or 10 extra hazards that exist around psychological injury and assess them in exactly the same way that you would do anything else. Because, you know, I've put these suicide numbers in here, and I just want to put these into context, right? 1 person every 2 minutes death by suicide globally. Yeah, that's horrendous. Yeah. Last year, obviously, COVID started this time last year. By the time we got to December last year, was it 1.3 million deaths by COVID? I'm not exactly up on the money with the COVID numbers. 1.3 million, I think, is a rough number globally, death by COVID. Over 1 million death by suicide. Okay. So, you know, we have, where are we with mental health? Are we at pandemic? Are we an epidemic? Is it just an outbreak? It's a pandemic, and it's a global one. And there's all of these different forces. You know, we've got global recession, global pandemic, and now a global mental health issue. And if we don't do anything now to move this forward with the standard and everything else that's coming in place, you know, we don't deserve to be in business and leading organizations the way that we are. Yeah, because without the people in your business, you don't have a business anyway. And the sooner employers switch on to that and invest in that in the right way, the better. and actually the more benefit they're gonna get from it. So workplace mental health is often done this way. Okay, all really good stuff, all really, really good stuff, but that isn't going to fix workplace stress. Okay, mental health first aid, employee assistance programs, all focused on injury management. That's like having no safety procedures and just having physical first aiders and a hotline to the GP. You know, it just doesn't fix the problem. Okay, and then we can do some exercise classes, brilliant, nutrition workshops, fruit bowls, yoga, wellness apps, meditation, mindfulness. We can do all of these things, right, around promoting flourishing and keeping people happy and healthy. But the only people that are really going to engage in that, and I think, Trina, I may have had this conversation with you, is people that are already switched on to self-care, that are already in that good space. So
yeah, definitely.
yeah, isn't it?
Yeah.
And it's like you'll find the same people that will turn up for the classes, and then the ones that sit in the middle, these people that are languishing, that are not feeling motivated and mentally well, they're not going to engage in these. You know, if you're lucky, they don't engage with MHFA because they managed to pull themselves out of it. But 9 times out of 10, they're the forgotten bunch in the middle that a lot of workplace mental health strategies miss. They're the people they're aiming for, but they are missing the mark completely. Okay, so what we need is this really integrated model of workplace mental health that focuses on mitigating illness, preventing harm, and then promoting flourishing. Okay, so you know, this is the national standard of Canada on psychological health and safety. Canada do this well. This is also, as we go through this presentation, it's the exact same scope of the ISO standard. Okay, promote well-being, prevent harm. It's that simple. Okay, so as I said before, in the UK, so if who here is familiar with the mental health continuum? Generally, nods. Yeah, Philippa, you are. Karen, have you done mental health training?
I haven't, so
I'll just quickly run through it. So what we've got in life, like we do with physical health, our mental health exists on a continuum. So this here is the mental health continuum, and there are 4 segments on the continuum. Okay, so and I'll put this to how I perceive it in terms of the equivalent physical basis. Okay, so when we're flourishing, we're in a really optimal place of well-being. We're highly motivated, we're highly functioning, winning at life, positive relationships, everything is rosy in the garden. Not loads of us exist in there. There's a few of us, yeah, that will go in there, or we'll go into there occasionally in our life, just when, you know, everything's just going right. For me, that's the equivalent of training for a marathon. You're at the peak of your fitness, you're going for that triathlon, you're really flourishing. So that's kind of the physical equivalent. Mental wellness, I'm well, I'm motivated, I'm going out, I'm doing my work, I'm getting on, life is good, but I'm not really kind of flying up here. I'm mentally well. That's the equivalent to me of being physically well, waking up in the morning, no aches and pains, off I go, I'm good. When we get to languishing, again, a psychology term for where you don't sit in mental wellness, but you've not got a diagnosable mental illness. Okay, so if you think bereavement, divorce, COVID, social isolation, there'll be a hell of a lot of the workforce that are existing globally in languishing. And when we're in languishing, we're going to go one of 2 ways. Okay, we go up or we go down. Okay, and in terms of languishing, what we need is strategies in the workplace to support people that are struggling. Yeah. Now, whether that be recovery, we've got a great culture, so we've got a recovery at work. So you know, get that culture where you can go to your boss and go, do you know what? A close relative's just died. It's having a big impact on me. I've got this big project on at the moment. I really appreciate some support at work to delegate that because I don't think I can give it my all. Rather than that person plodding on, struggling, not saying anything, missing the deadline, losing the contract. It's, you know, and I'm really simplifying when I'm talking about it. So we've got this languishing element, and then we've got mental disorder. Okay, 1 in 4 people in your workforce, 25% of your workforce yeah, will experience mental disorder at some point. Yeah.
Sheila, can I
Yeah.
just jump in and say then, given the statistics there, 1 in 4 for mental disorder, and then languishing, I feel perhaps that covers quite a big population of people as well. Wouldn't that segment of languishing be a bit bigger then? Wouldn't that, considering where we are?
I mean, they're going to do this all the time.
Oh, right, okay,
Yeah.
oscillate.
When you're going to look, you know, that the point is that it's a continuum.
Sure. Okay.
We'll just go up and down and up and down at all points in our life, you know, and you know, you might be. We move along. That's the point. So,
Sure. Okay.
so just doing something in terms of a workplace strategy that focuses purely on here, in terms of mitigate illness, which is what we do at the moment, isn't going to do everybody. Okay, just doing stuff here around health promotion isn't really going to, and it's not targeted neither. It's not really going to meet everybody. And this bit in the middle, the legal bit, we're not doing. It's like, why are we not doing it? So this is where we really need to kind of be focusing our efforts, because if we can understand what's going on, we can fix it like anything else. So, you know, this alternative approach is to address the design of the work and not focusing on the people. There's too much emphasis on a person-centered approach and not an organization and process-centered approach. Okay, so, you know, got a lovely beefy muscly guy here. If you weren't so beefy and you weren't so muscly, say it was me with my little guns here, you know, went for a job packing boxes in a warehouse. If I walked in and I wouldn't be given a gym membership and be told to you can move on to box packing when you can lift 50 kilos. It wouldn't happen. I wouldn't tell a box packer to go to the gym to lift heavier boxes. We have guidance and rules and safe systems of work in place to prevent injury. Apply the same for psychological health. Why do we do that for physical, say, manual handling? Yeah, if it's a stressful job or a stressful way of doing the job, we tell people to be more resilient. It's like telling a box packer to be stronger. No, I don't necessarily need to be more resilient. We maybe need to look at the way work is done, fashioned, my workload, whatever it is. Why am I stressed? Yeah. Is it because I'm really not suited to the job? Then fine, I'm not suited to the job. 10 other people are doing the exact same job. It's a performance issue then, performance management. And the point is, have the right structures, have the right systems and the right processes in place so you can have the right conversations and make the right decisions. Yeah. Mental health isn't about giving people a get out of jail card for poor performance. Yeah. It's about being able to manage your business. If there's a better way of doing things that causes less stress to everybody, do it. Yeah. If the person doing the job just can't cope, go through the processes and part ways. Yeah. If other people are able to do that. And I'm being very simplistic in my view there. But that's basically what we need to be doing. It needs to be a part of a systemic process. So good news is we've got ISO 45003 coming in, right? Not the law, but voluntary standard. It's a child standard of 45001, which is an international standard for occupational health and safety management. Okay, so it's laid out like a normal quality management standard. This standard slots in right alongside it. Okay, but its emphasis is on psychological risk and how you do that. It's been agreed as best practice, yeah, across 70 odd countries have had involvement in this, right? So it's global agreement. And this is really shifting this focus from the individual to the organizational process and work design. Okay, so you look at the scope of ISO 45003, it is to prevent injury, the prevention piece, and promote well-being under an occupational health and safety management system. Now, it's suitable for all organizations of all sizes, yeah, from 3 employees up. You can use this framework. Doesn't matter what industry, yeah, people are people, no matter where they work and how many you've got of them, yeah. So what it does as well is you're looking here at this as a shared responsibility of workplace mental health. So prevent harm, mitigate illness, promote and flourishing, that's down to the employer, okay, to provide that safe place of work. But the employees, you know, they've got to look after themselves as well in terms of self-care. So what we want to do, in terms of this integrated model, we want to give tools that help to do both. So when we look at the actual standard, these are the kind of key elements, and I'm really simplifying here, okay? But it's about managing the risk within the occupational health and safety system, okay? Because once you put something into health and safety rather than woo-woo well-being or people fluff, health and safety has more organizational clout, yeah? So it's firmly putting it in the health and it ties in with the law as well. So it's firmly putting it in the health and safety remit. It's about using a risk-based approach and understanding what's going on in your organization. Yeah, it's the context of your organization. You can't do effective integrated workplace mental health strategies if you don't talk to anybody. We've all worked in organizations where the leaders think this is happening and the employees don't. You ask them, you ask a leader of a business, what's the general culture around workplace well-being or the environment, and then you ask the employees, you're going to get two completely different answers, okay, 9 times out of 10. So we need this leadership and worker participation and consultation throughout this whole kind of program. We need documented processes, policies and procedures so people are clear on what the framework is, and organizational responsibility. Somebody's got to be responsible for it. Somebody's got to own it, yeah, at different levels of the organization. And with the risk, we've got to do this psychosocial risk: identify, assess, control, review. It's what you do for physical safety. You just need to do the same for psychological safety. And then making sure that we've got competency in the business, got resources that are needed, and training for everybody. Okay, no point training 5 mental health first aiders to support 1,000 people. Yeah, the number of times we've rang organizations and said, do you have mental first aiders in your business? Right now, unless everybody in most companies hates the receptionist and don't want to support them, yeah, it's not communicated well, because the first person that answers the call has no idea, and then they'll come back 10 minutes later and say, oh, we've got 16 mental health first aiders. I never knew that. What do? They'll ask us. Okay, so it's not the solution. It has to be systemic and part of your culture, okay, and applicable to everybody, and then all done within this quality management framework. So you don't put it in and walk away and hope that you put it in and you tick the box and that was it, and you go back. You have audits. Are we doing the risk assessments? Are we carrying out management reviews? Is the improvement plans, are they being executed? Are they having the desired impacts? So like you have management reviews in your business that you talk about all of these different factors in terms of sales and quality and rejects and business processes, you do the same around your workplace strategies. And then you go again. Yeah, it's just this continuous improvement cycle. So that's it in a nutshell. It makes sense. It's common sense, okay? Now, you'll get different views out there when you go on LinkedIn or you talk to different people about whether ISO is the answer. It's a starting point. It's the first revision of the standard. As with everything, you use it as guidance. You apply common sense. If it needs more, do more, but don't do less, okay? Or have a reason for doing less to justify that if an auditor is coming into your organisation, okay? And some parts of it might not be applicable to your business. And this is it. It's about the heart of ISO is the risk assessment. Identify the risk, assess it to determine the kind of impact of that risk and what you can do to mitigate and control that risk. And then how do you assess how well that's worked? Okay, so can I ask you, anybody, just unmute yourself. What are psychological hazards in the workplace? Can anyone tell me? Otherwise, I'm going to pick on people. Philippa.
Could be bullying.
Yeah, bullying. Absolutely, that's one of them. Yeah. Anybody? Anything else?
The workload itself.
Yeah. Absolutely. Absolutely.
I guess there might be an element of the physical environment.
Yeah,
that's
the physical space.
Potentially safety.
Yeah, absolutely. I mean, there's lots of hazards, okay? But these are the main ones, okay? So as you say, Trina, it's our workload, our autonomy, how much control we've got over the job that we're doing. Are we expected to do our job being micromanaged? Are we left to get on with it? Are we, what's the level of autonomy that we've got? Are we really clear on our roles? Are we supported by our managers and our co-workers? Yeah. As you say, relationship conflict, that includes bullying. Do we feel rewarded and recognized for what we do? And I don't mean necessarily financial recognition, but, we all like a pat on the back. We all like to be recognized for our efforts. And are we consulted on changing the organisation well? And do we perceive that everybody's fair? Yeah. Well, it's all right for sales. They get all the perks of the business. Us in accounts, we get nothing. What's this perception? Do you have silos in your organisation that not interacting together? So we need to understand this. Okay. So how do we understand this? What's the approach we can take? Yeah. Anybody? It's really simple.
Communication.
Yeah, we ask people. We ask people. And the way we do it is we ask them a barrage of questions, okay, to identify the hazards, okay? So we have, we use a digital platform that has survey tools in it and learning management system built in, okay? And it's all organisation. And what we do here is we carry out surveys that assess the individual's perception, right? So it's an individual's perception. This is the woo-woo-ness of well-being. We don't really know what people are thinking. Well, you do if you ask them and listen. Not really rocket science. So we're looking at their perceptions of work experiences. Sorry, I keep looking over here because this screen's bigger and I can read it. That either support well-being and productivity or contribute to stress, okay? And once we've asked the questions, and it's really, it takes 15 minutes for us to get feedback from an individual, and we do it electronically via an app. So we send them a ping, can you answer this survey? This survey is completely anonymized, okay? We don't see what you've said. We can't see any results until a minimum of 8 people have answered the survey, okay? And then we start to build up a picture of what the collective view is within the organisation, which we can then slice and dice by departments, job roles, that type of thing. But we make it generic enough that we protect everybody's anonymity, okay? So we ask them, yeah? And when we ask them, then it comes back to us with the results, okay? So in terms of the results, we look at this then from highest to lowest or lowest to highest. Anything that scores below 50, we need to be looking at, okay? And it tells us what percentage of the organisation are at risk, yeah? So in here, just under 40% don't feel that they've got the right work-life balance, over 40% are pretty neutral, and some of them, just under 20%, think they've got it absolutely spot on, okay? So we can actually quantify people's thoughts and feelings based on what they've told us, based on a set of predetermined questions, okay? We can add our own questions in. We can pick and choose which questions that we ask or which sections we ask, okay? So once we've got the results, our consultation with everybody, this cooperation, we'd have a health and safety wellbeing committee representative of people across the organisation. We consult back with them. So, hi, work-life balance is flagged as an issue. What is that? What's going to make it better? 9 times out of 10, the people doing the jobs know exactly what the solution is, okay? So ask them. What you will find on a mental well-being management plan, and bear in mind, this, is your risk assessment, okay? This is your risk management improvement plan, okay? And all you're saying is we've looked at a department, we've identified workloads and issue, and actually what we've said is we're going to cut meetings down to 30 minutes, or we're going to put a service level agreement in. I use the example, we had an organisation that was a training department, and they were being asked consistently for training materials to be turned around in less than 8 hours when it had sat on somebody else's desk for a week, okay? It's a simple service level agreement in, yeah? They didn't have a workload issue, they had a communication issue. And then once you but the thing is, what you're doing is you're bringing these factors to the front to enable conversations to get to the root cause, because we all know what happens in organizations. Oh, blooming heck, sales have had that on their desk for a week, they've only just sent it over, but we all work like crazy, yeah, to deliver it until the next time, and then it happens again and we have the grumbles. So let's just get on with fixing the problem, yeah. But this is a tool and a diagnostic to help you to do that. And then when we've done it, like anything, you put your objectives in, you put your actions in, who's going to be responsible for it, when are they going to do it by, when are we going to review it, and then did it work? Okay, so we go back and we resurvey. We either survey those hazards or we survey the whole group again. But what we can do is go, okay, and you've got to compare apples with apples. You can't survey one group and then compare it with a different group if you're looking at trying to measure the improvement. So you go back to the same group of people 6 months later when you've done your corrective actions, and you go, oh, what changed? So what emotional demand, relationship conflict and autonomy, 3 of my biggest risk hazards, and have we seen a positive improvement? If we have, brilliant. If we haven't, we go again. Didn't work, why not? And you don't leave it till you've sorted it. Okay, it's that simple. And you would do that if you had a problem with a piece of manufacturing equipment that was chucking out rejects. Yeah, you would not go and employ a massive team of people to fix rejects. You would go and take your engineers and you would look at what's going on in the machine and you would fix the machine, and then the output would be less rejects. We're doing the same with the people in the organization. So it has to be this system, and this is what I'm saying, it has to be this systemic step-by-step process. And I don't know how many of you work in manufacturing.
Can I just quickly ask?
Yeah.
Is that then, can someone do that, make those measures, get those results, and then directly overlay that to another quantifiable, which is numbers? Because businesses always care about the bottom line. So then could we then correlate that and say, this is why the numbers went up in that period, because we had these positive effects?
Yeah.
Is there some,
yeah, I've got some financial and some cultural KPIs for you that we can show, because you're absolutely right. Leaders want to see a demonstrable return on investment. They want to know that they're having an impact, but actually they don't at the moment. They just want to put MHFA in and forget about it. So actually it's not quite true. So if we look at, if you've worked in a manufacturing environment, Kaizen is one of these methodologies that's all based around continuous improvement. Okay, so if you put mental health into that context, the definition of Kaizen is a strategy where all employees work together, proactively, to achieve regular incremental improvements. So this isn't about fixing everything all at once. This is about taking step-by-step processes on a continuous basis all the time till we get where we want to get to. And we'll never get to where we want to get to because we'll always want to improve, because the world will always change. But it's a really powerful methodology when executed well. And this is, you're developing a culture where everybody's actively engaged. If you're paying lip service to mental health, employees know that. We're not stupid. We're human beings. We know when somebody's paying lip service to our well-being, and we know when somebody really cares. So we want to develop this culture, and it's dead simple. Let's get the employees involved, and this goes back to what I've just said. Gather a list of problems, encourage solutions and an idea, test the solution, regularly measure it. If it's successful, adopt it. If it's not, go again. But either way, you're going again and you're going again and you're going again. Okay. And that's where we have this digital platform that we use called Flourish. Okay. And I don't know whether you've been following any of the Psych Health and Safety podcasts that they've been doing out on LinkedIn, but a really useful source of information. And we'll be doing the UK equivalent, start kicking it off with them in a couple of weeks. But with Flourish DX, we've got 2 platforms. So we've got a platform mainly for work, for workplaces. And then we have another one aimed at education and schools and universities and secondary schools. But for today, I'm just going to focus on the workplace solution. So within the workplace solution, what we've got is the survey tools. So with the employee surveys, okay, we've got 4 different surveys here. We can do regular check-ins like temperature checks, pulse surveys with employees. We can do the work design, so the work, the psychosocial risk assessment surveys in there. And we've got other survey tools that we can use to get feedback on the general well-being of the organisation. So we can get data, we can ask questions and get information back in an anonymous way. The platform is designed to be a compliance tool for ISO45003. So it's been designed, the functionality has been designed to meet the requirements of the standard, okay? And it ticks, I hate using the phrase, it ticks all the boxes, but it does meet the requirements of the standard throughout, okay? But what this really does, and I think where this is really powerful, is it gives whole organisation training within the platform. So hours and hours, over 30 or 40 videos in there that are in small bite-sized chunks, which is basically mental health awareness for the whole organisation, okay? And not only mental health awareness, we have leader training as well. So, with leaders, you think about it, we get promoted to be managers. And as managers, our role has always been to manage performance and to manage results. Now we need to manage people's mental health. We need to manage well-being. We need to manage psychosocial risk. Where's the training? Where's the education? So we need that specific leader training in the business, okay? So we need to disseminate that easily, and that's done very simply within our product. We've then got a bunch of employee tools. So remember I was saying about it needs to be this shared responsibility. So we give them stress reduction tools. They've got access to well-being check-ins and mood journals and how they can improve their well-being based on the positive psychology model of PERMA. We've got the education and we've got digital coaching. So the product is twofold in so much as it gives the employer what they need in terms of data, and it gives the employee tools to help them in terms of self-care. Okay, and going on to what you were just asking, Carl, in terms of the KPIs for the business, we've got 2 types of KPIs when it comes to workplace well-being. One is around culture and the other is around financials. Okay, so we specifically ask in the survey, what would be your intention to quit the business at this point in time? Yeah, so we know if you've got 500 employees, 200 might say anonymously, I'm out of here. Given a chance, my intention to quit would be here and now. Okay, massive indicator of what's going on in your workplace culturally. Okay, so really good. You need to understand where your starting point is and then where you're going to go to. Your burnout risk. How many of your employees feel that they're at risk of burnout? They'll tell you anonymously. You can see the figure. And again, stigma. Would you access EAP or mental health support? If not, why not? It tells you a lot about the culture of your organisation, okay? That you wouldn't necessarily get if you're asking people face to face, yeah, or in lunch and learns and all these other good things that we can be doing. So we've got that in terms of culture. And then, in terms of employment KPI, financial KPIs, if you look on your P&L for your business, you'll see a cost for staff cost, big lump of a number, probably bigger than a lot of your fixed assets and all the other stuff you really take care of, probably more than your company cars. But your staff costs, as in wages, you'll see generally as a lump a number. But why don't you break that down? Look at your staff costs and then look at, out of my staff costs, how much of that was non-disclosure and settlement agreements when we've parted ways with employees and we've paid them off, right? How much of that has been on tribunal costs if things have got that bad? How much of that has been on just absenteeism? What is our absenteeism rate? Let's take an average cost of the day and look at our absenteeism costs. So what I'm saying is break it down, know what your numbers are within there. Yeah. So once you've got your absenteeism costs, going back to that slide I was showing about the average cost per employee and what the figures are, you can then start to see how you break down as an organisation, total staff costs, what percentage is absenteeism. How long do people stay in your business? Okay. And that might be relative to your industry. So you need to maybe look at some industry benchmarks there. But what's your attrition rate? You know, if you've got a high employee-led attrition rate, yeah? What's that saying about your organisation culture? What's that saying about your workplace if people are coming and going really quickly? Also, when, you know, it costs to onboard employees, it costs to offload employees and get new ones in. So what's your employer-led attrition rates? Okay, so if you're constantly getting rid of people because you haven't got the right people in your organisation, what's going on with your recruitment process? What are your recruitment costs? So you can start to look at where you can really track what this is costing you, okay? And that's without even measuring the biggest cost element, which is the presenteeism, which is going to be very unique to your business. And you can look at ways to measure that in terms of kind of, you know, how your sales have improved or your turnover and your margins have improved. Yeah.
All right, Sheila.
Who's that? Hi, Paul.
This is Paul. Can I ask, in terms of burnout risk, how do you measure that?
We asked the question.
But do you ask, are you burnt out, or do you use an instrument to measure burnout risk?
No, we ask the question, do they feel that they're burnt out?
Okay.
But we do have within the platform specific kind of medical questionnaires, if you will.
Yeah.
So things like, I think in the UK we've got, is it GAD-9 and so the anxiety and depression questionnaires that your doctor would have you fill in. Those do exist in the platform. We don't, and again, what I would advise with that is, you know, we need to work with occupational health and look at when it's appropriate to use those. Does that answer your question, Paul? Okay, so this is where we can kind of look at.
My internet's going dodgy. I can't hear.
Yeah, I think your internet's going, Sheila. I was having the same issue. Are you?
Oh, okay.
Okay, is it coming up with an error?
Okay, sorry. It might be my internet. My computer's going to the poorly shop this afternoon, so I was hoping it would hold out for the webinar. And then I just want to finish on this slide, okay? And then we can stop.
That's great, Sheila. Thanks.
Okay, fantastic, Paul. Yeah, this one really, really, really annoys me, really gets me go. Okay, our people are our greatest assets. I hear it so many times, okay? Yet we pay more attention to maintaining and servicing plant, equipment, facilities and company cars than we do individuals, yeah? Our businesses can run without some of those things, but our businesses can't run without people. So we need to, you know, if we've got, and the analogy I always use here is that if we've got a piece of equipment on the factory floor, right, and we've just bought this new shiny piece of kit that's going to improve our output, yeah, by 50%, allowing us to be able to sell 50% more, we would have a maintenance contract on it. It would be on our balance sheet as an asset. We would have maybe a service manager for it. We definitely have a contract on it. We'd look at machine optimization and how well we set that up, and then off we go. All right. Why do we not do that with people if they're our greatest assets? Yeah. Create an environment, set that up, optimize the work design so that you get the best and the most out of your people.